Hi, good afternoon. With me today, we have Laina Emmanuel, the founder of BrainSight.ai, a very, very interesting cutting edge startup that is focused on neuropsychiatry and neuro-oncology. Laina, great to have you as a part of Project Amplify, a program in partnership with Microsoft and Accenture. Tell us more about why you started BrainSight AI and what was your background and a little bit more about yourself.
Sure. First of all, thank you so much, Lathika, for both the Project Amplify support and for calling me here. Happy to speak about my journey. So I am most people in India, an engineer by training. I was coding operating systems at NetApp for a couple of years, and before that at the Offshore Development Center of Cisco at Infosys. I then went on to do a lot of work in international development in the healthcare space. My interest really lay more on the impact of technologies than on the technology itself. And so I was really working with the government at different levels for things like maternal mortality, vaccines, logistics plan, etc. It was around this time that I also did my MBA in healthcare from ISB, and I was then looking at building a startup which kind of brings together the joy of tech and the impact together. And that's when I met Dr. Rimchim Agrawal, my co-founder. She had done some really cutting edge work as part of her PhD in neuroscience. She was looking at neuroimaging indicators for disorders like schizophrenia, bipolar, dementia. So really looking at neuroimaging indicators for that. And this is such an important question to address and such an important thing for doctors to know about that to me, it made a lot of sense to build a company around this. And since Dr. Rimchim was also very excited about it, we got together as part of this program called Entrepreneur First. What we are building at BrainSight essentially is a neuroinformatics platform that allows doctors to answer questions that they couldn't answer before. So really looking at, does this person have early forms of dementia? We map the brain function. Think of it like your traffic map of your brain. So we look at the traffic map of the brain and are able to decode patterns in it, which allow you to answer questions about early forms of dementia, or to tell you how exactly you should create drugs for neuropsychiatric disorders, which could be more personalized, or how can you help in the surgery of brain tumors by actually mapping the function around the brain tumor. So these are some of the questions. All of them have a the basic technology is the same. You need to map the function of the brain, and that's what we do with our neuroinformatics platform.
Wow, that just is absolutely phenomenal. Every time I speak to you, I get, super excited because, like this is rocket science. This is, this is what brain surgeons do, right? So this is going to just help them do a better job in terms of what they're trying to do. You've been around now about 18 months or so, but you have made some great strides. Tell us about your early findings. How have people, adopted to what your early findings are? I know you've raised funding from the Stanford Angels, no less. Clearly, they see a huge potential in what you're doing. So tell us about what we all have to look forward to from BrainSight.
Sure, absolutely. Happy to do that. So I'll start with the initial findings that Dr. Rimchim had as part of her PhD at NIMHANS, because that really forms the bedrock of what we are doing. So what they had discovered was when you use AI on brain function, which is AI on the traffic map, what you're able to find is neuroimaging indicators, the only neuroimaging indicators for schizophrenia. So the background for it is over the past few decades, centuries, there have never been any neurobiological indicators for psychiatric disorders. It's been mostly symptom-based, and psychiatrists have to really ask questions around mood patterns, etc., to the patient, but they don't really have a diagnostic aid which can help them get to more definitiveness. So her research really showed that neuroimaging indicators based on fMRI can be one of these indicators, and it's a very powerful one. So this is something that is being debated by the World Psychiatry Association, and there's a lot of work being done around this across the globe. We started with psychiatry, and these were the initial results, but we realized that the underlying technology can also be used for your dementia, can also your neurological disorders like dementia, and for your neuro-oncological things like cancer. Right now, we are doing a study which is funded by the Government of India on the early mapping of dementia. The results for it should be out in the next 6 to 10 months. Because of COVID, the study got postponed. The hospital we were working with was a COVID hospital, so we couldn't really recruit patients for that right now. But now the study has restarted, and we hope to kind of show initial results around it over the next 6 to 8 months. Apart from this, we've also been working on the neuro-oncological piece, and which is really exciting. So being able to show doctors that around the tumor, when you are able to show that this is where the foot function is, this is where the hand function is, that kind of information is not available for doctors right now. The only other alternatives is either you do this thing called a task-based fMRI. So you ask the patient to go into a machine and like clap their hands, or read a piece of text. That's very difficult for a patient who's cognitively challenged, and almost 40% of these patients are cognitively challenged. So doctors often have to go into the operation without this information, or they'll have to use invasive techniques like open brain mapping, where you're looking at direct electrical stimulation to understand this. What we are able to kind of bring into the picture is this resting state fMRI based work, where before the surgery, you can get this kind of information, and that can help the neurosurgeon make better decisions. So we are looking at those also right now. In fact, we have just about we're publishing, we just got admitted into the RSNA, which is one of the biggest radiological conferences, and are presenting our results there over in the next, by November. So yeah, we're looking forward to that.
No, this is actually, path breaking, because I think in the world of psychiatry, the little bit that I know is that it's always almost a guessing game in many of the, psychiatry disorders that are out there, right? You're not quite sure who is, what's going on. Psychiatrists try their best in terms of the diagnosis. Here, what BrainSight is actually doing is providing them that tangible scientific information that you're looking for, versus more of the subjective information that today the psychiatrists have to work on, right?
True.
So I think that really is just phenomenal. My question to you is, again, when you are saying that you can make the early prognosis and diagnosis in something like dementia, how does that really change for the patient? Is it catching it early? I definitely understand from a neuro-oncologist what that means is that they're able to perform their surgeries better. More knowledge is power. They're able to make sure that they have not necessarily taken out more than they should, and what that impact would be. But for dementia, what does early prognosis and diagnosis mean?
Absolutely. That's such a great question, Lathika. So I think let me start with, over the past 20 years, there have been more than 200 failed clinical trials for dementia. And the reason is you're unable to recruit patients at an early stage to be able to even figure out how the medicine is working for them, right? Now, one is that's because till now there were no neuroimaging indicators, no other way to kind of look at it at an early stage. fMRI is one of the earliest indicators which can show. In fact, there's a lot of work being done around eye scans you would have seen around dementia. So where an eye scan can possibly catch the protein deposition behind the retina at around year 4 or 5, it's the resting state fMRI, the brain pattern changes can be around year 0, 1, etc. So when you're able to see those brain pattern changes and you're able to track that over time, one is we do hope that over time this can help in better drug being able to produce better drugs. Second is what we've seen from doctors. In fact, till last year, when we were talking to neurologists, they were like, there are no drugs available for this. What will we do? We can help the patient manage this better, but there is no drug, so why should we scare the patient? And that's a very valid question, really. But now there are drugs which are coming out, and you need to be able to see what are whether this patient really needs that or not. And even without the drugs, early management of dementia is one of the key things to manage this for a longer time. So these are some of the ways that we think our work can help.
That's great. I think the whole world will really be extremely grateful to BrainSight for coming up with this early, prognosis and diagnosis. Dementia seems to be something which is really sad, and the faster it is diagnosed, better drugs that come out there. I think lots of families world over will be highly grateful. My last question to you, Laina, is that you are in a world where you have to have a lot of patience because it's a lot of research based. You have to be extremely accurate. You're talking about the brain, etc. Right? This is not like other startups where they can do a prototype, ship something out in 6 weeks, come back with customer feedback. This is something that this is a marathon. This is not your 100-meter sprint. How do you and Rimjim, deal with that, right? In terms of what do you believe, what keeps you going on a day-to-day basis?
That's a great question again, Lathika. So completely with you, it is a long-term thing, and I think after when I was out fundraising, one of the things that I used to tell myself, I'm only looking for funders who are in it for the long term with us, because you see a lot of startups which show a lot of progress immediately, and that makes it, and that's a great way to look at it. But this kind of work doesn't really fit into that criteria. For Rimjim and me, I think both of us come from a space where we care about impact quite a bit. We've seen families being torn apart by these disorders. We've seen that these disorders, I mean, honestly, it's one of the most pressing problems. It's the third largest contributor to the global burden of disease. It is an exciting problem, and it is a problem with huge business potential. So I think when you look at all this, to me, making a startup is difficult, no matter if you pick a small problem or if you pick a big problem. The amount of hard work you have to do is the same. So why not tackle a big problem and then try and solve that and probably fall flat on your face? If not, you will learn a lot. I think both of us come from that perspective. But also the other part is we have been putting in processes where we work with stalwarts. Like, I think this kind of a startup requires a lot of ecosystem support, and that is where I think like the Amplify program really helps us, because I think it's very difficult for a small startup to make such big impact. And when you have people who are supporting you, who are saying that, this seems like a good problem to solve and we want to support these people, it makes a lot of difference. So these are some of the ways that we are tackling this. But
What I'd like to end with saying, you're not going to fall flat on your face. You all have already done phenomenal progress in the past 18 months. Hang in there. We're here to support you, and we really, really believe in you. And thank you both for digging into a problem that is not easy, but absolutely whatever the findings will be are so relevant to all of us globally. So good luck and look forward to your journey.
thank you so much, Lathika. It was a pleasure. Thank you.
Same here. Take care.